Welcome. I'm Joe Fab. I'm a documentary filmmaker, and my recent film, When My Time Comes, follows NPR journalist Diane Rehm as she explores the subject of medical aid in dying in the U.S. Aid in dying allows a terminally ill patient with a prognosis of 6 months or less to request medication from their physician to end their life when their suffering becomes too great for them to bear. The number of jurisdictions where this is authorized has expanded rapidly in the past 25 years. While making that film, I met a number of inspiring physicians who were committed to ensuring that their patients have autonomy at the end of life. When Compassion & Choices offered me the chance to help create a series of short videos with some of these doctors, I leapt at the chance. Doctors like Catherine Sonquist Forrest.
This is a man who was a brilliant scientist and epidemiologist, and I'd have done anything to keep him longer. Honestly, I'm a physician. I'd have done anything to have more days with him, even if he couldn't talk to me.
As a young physician, Dr. Forrest cared for AIDS patients in San Francisco at the peak of the global AIDS pandemic. So it's not surprising that she began to focus on how to provide the greatest possible comfort to patients facing the end of life.
Early in my career, every one of our patients died. Hard to explain to someone who wasn't through that pandemic of the impact of that on a human. I think the reason that I really connected with the concept of aid in dying particularly was that my own mother would have used legal aid in dying. She had cancer, and nothing that the medical profession could do was helping her pain. Nothing. She died at home in hospice care. I was with her. But it had made a huge impact on me in being attentive to how I care for people in hospice and where trying to be attentive to what they wanted at the end of their lives.
Although medical aid in dying was not legal in California when Dr. Forrest's mother died in 2009, she asked her daughter to work to change that. And Dr. Forrest was active in bringing about passage of the California End-of-Life Option Act in 2015. And she became one of the first prescribing physicians under the new law.
The line is that really speaks true to me sometimes is that most people are one bad death away from supporting aid in dying. My own husband used aid in dying only this year. He was diagnosed with what they thought at the time was ALS. They now understand that it's probably a complication of COVID. He was told he would die by suffocation or choking. We're coming back from the appointment where he was told that he had a terminal diagnosis and that it was going much more rapidly than they thought, and that how he would die. And he said, "My God, Catherine, if you hadn't, thank you for working on this law, because I didn't have access to aid in dying, I would be terrified every day of my life." That's what he said to me. And this is a man who was a brilliant scientist and epidemiologist, and I'd have done anything to keep him longer. Honestly, I'm a physician. I'd have done anything to have more days with him, even if he couldn't talk to me. But it's his call, his choice.
Because Will Forrest was enrolled in a Catholic healthcare system, his own physician wouldn't and couldn't prescribe medical aid in dying for him. His wife couldn't prescribe for him either, since medical ethics prohibit physicians from prescribing for family members.
Ironically, his access was through his specialists at, through Stanford, where he'd been a patient before. And ironically, I had set up that system when I was on faculty there. But it still took well over a month to get access for him, which was an excruciating, anxiety-filled month for him, especially since his disease was progressing so rapidly. He wanted to live. And it was only when the suffering arrived at a stage where he was choking and gasping, and the options were only to be on a feeding tube and to be on a breathing machine, and he made the decision for himself. And it was a beautiful death, very peaceful. And I'm grateful for him. that he didn't die in a way that was painful and suffering for him.